Thanks for joining us, kind of expanding our minds, learning more about this exciting therapy. I'd like to start with just a little information about me. This is a procedure and treatment I'm very passionate about, kind of where my path started. I'm from the East Coast, from New York originally, but don't hold that against me. Kind of moved out here for my love of the mountains and the outdoors, big into snowboarding. But kind of started my training, New York City, moved to Boston for undergrad, medical school in Scranton, Pennsylvania. After that, I moved to Hawaii for a year of surgery, back to New Jersey, where I was living in Philadelphia, where I trained in anesthesiology and pain, which is where I first got exposed to this therapy and first developed a passion for it. When I was in training, I had the real pleasure of working with one of the world-renowned physicians developing this therapy, someone we kind of call the grandfather of spinal cord stimulation, and someone who's worked very closely with him. So I guess that would be the grandson of the grandfather of spinal cord stimulation, who I had a chance to work with as well. So kind of developed this passion early on. So that's just a little bit about me there. So kind of get into it. So what is pain? So that's something, if you're here today, you're either very familiar with, or you're familiar with someone who is very familiar with pain, right? This is not uncommon. It's one of the most common reasons that, patients visit a healthcare provider in this country. And it's one of the largest expenses and reasons for healthcare expenditure in this country as well, unfortunately. So what exactly is pain? So pain is a perception, right? It's an interpretation of information from the nervous system. And, there's an emotional component to that. There's a psychological component to that. It can affect all sorts of parts of your life, your relationships, your emotions, how you interact with yourself, your body, and it can really have an impact on your life overall, right? So how is that working? Well, there's nerves all over your body. The peripheral nervous system identifies an abnormal signal, either electrically or chemically, which activates a nerve that, again, chemically or electrically, goes through the spinal cord, where we then interpret that at the brain, and that's where we perceive and interpret that signal, right? So that's kind of where that pathway is. And then that brings us to, where does this therapy kind of come in? Well, this therapy intervenes at the level of the spinal cord, where those abnormal pain signals are being sent through before they're interpreted in the brain. And we'll get a little more into that in a little bit here, but I just wanted to see if I can clarify that. So again, what's the definition of when does this become chronic? Different societies have different definitions. The most agreed upon is over 3 months. At that point, by definition, you have what's called chronic pain. Acute being, hey, this has been going on for less than a few weeks. Subacute, you're looking at a few weeks then. And again, 3 months, it's become chronic by definition. And at that point, that nervous system has now been interpreting and perceiving this pain signal for so long, it can actually ramp up the entire nervous system. And now these signals can become abnormal, even if the reason that original nerve was firing to tell you there was an injury is no longer there, right? And again, these side effects this can have, it can affect your sleep, it can affect your relationships, it can cause weight gain, weight loss, all sorts of, complications from this abnormal signal that's still being sent. So again, just kind of how common this is, you're not alone out there. This happens, unfortunately, we see this every day, not just because that's what we do here, but all physicians are seeing this every day, right? And the amount of money and the cost this, as far as our country, probably outweighs some of other countries, internationally. So this is not something that's new, to our country, to the world. And unfortunately, the longer we're living as humans, the more we're seeing this and the more we're spending on it. So just a few facts on that. So what do we do about chronic pain? Where do we start? Is spinal cord stimulation, a first line option? And it's typically not, right? So you're talking about, hey, there's a wire and there's a battery involved here. Is this the first thing I would recommend for you? Well, unless you've tried a lot of these other things that you kind of see on the slide here, it's not my first suggestion typically, right? So there's lots of other options out there. You've got medications, right? There's injections. Many of you may have tried these things, right? Changing your lifestyle, trying to take weight off the spine potentially, trying to strengthen and stabilize that spine with physical therapy. These are kind of where we start with as far as first line therapies. If that doesn't help, we kind of take that next step. Okay, well, that's not helping. What else do we have in our arsenal? We do our best to try to avoid surgery as far as neurosurgery, changing the architecture in the spine if we can, because we know that there's potential ramifications of that, right? The fact that it will lead to further surgeries, that it can cause scar tissue, that there's still going to be pain afterwards, right? But sometimes that's unavoidable and there needs to be decompressed. So, we fail those other therapies. Hey, I tried medications, I tried physical therapy. I still am just having this pain. It's not helping. I tried these injections and maybe they helped a bit, but I'm just not getting there. That's kind of where this therapy comes in. That's where the spinal cord stimulation comes in. I'm going to tell you a little bit more about that. And for some patients, even before they try cutting their back open as far as rearranging the architecture of the spine, that's where this comes in. For others, is actually after you've had a failed surgery, which is unfortunately all too common. If you're looking for more information about failed back surgery syndrome, we do have a good posting on the website that I was happy to author. Feel free to check that out. The other thing you're going to see there on the bottom of that bottom slide there is called a pain pump. That's actually putting medication directly into the cerebral spinal fluid that bathes the spinal cord and the brain. Pretty invasive. And unfortunately, what I've seen with that is there's complications. They're hard to manage. I've also seen those go kind of bad. Those catheters can kink, can land you in the emergency room and be very difficult to manage. If they get infected, it's kind of a nightmare. So we typically reserve those intrathecal pain pumps most commonly for patients with cancer pain or kind of terminal palliative pain, just to let you know where that kind of plays in there. So let's kind of get a little more into what we're talking about as far as, so what is spinal cord stimulation? So as I mentioned, you're talking about thinking of this similar to what a pacemaker does. So most people are familiar with the idea of a pacemaker, where you're creating an electrical signal to override an abnormal electrical signal that's already there, right? So in the case of the heart, well, okay, if the heart electrical activity is abnormal, well, let's tell it what to do so it does the right thing. In this case, what we're trying to do is actually create a nerve impulse to block the abnormal pain signal from getting from the peripheral part of the body through the spinal cord to the brain. So the question I get there then becomes, well, how do I know if I'm hurting myself, right? But what we're doing is we're not removing all of the pain signals. We're just removing that one that's abnormally firing, right? So it's removing that constant pain signal. So little information there. This is not a new therapy. This has been around since the 1970s. Like I said, there's already a grandfather of spinal cord stimulation. There's argument about who that is, but it's been around for quite some time. Most commonly, this gets approved for pain that is going into the legs, going into the arms. It can be approved for just what we call axial pain of just the back or just the neck. A little harder to get that approved sometimes, but it is also on label by the FDA for that. Just the insurance companies give us a harder time. But I just want to let you know that is something we can get covered with this therapy. Let's move on to the next slide here. So what is HF10 therapy and where does that fit in with spinal cord stimulation? So HF10 is an abbreviation for high frequency 10 kilohertz. So that's a frequency that you're using. And the company, Nevro, has a patent on that frequency. For years, this was being done, but it wasn't being done great, and it could be done better. And we figured it out. And when we figured it out, we're like, hey, let's try to lock that down so not everyone can offer it because they put in the time and energy to research it. So actually, Nevro has put in a lot of money, time, and effort on really large research studies to prove that this therapy at this frequency works better than anything else out there. So let's get a little more into that. So when we say a new type of therapy, this has been on the market for probably over 10 years now, so it's relatively new in that sense. But new enough that some of the older docs out there, the primary care docs, may not actually be familiar with it. So you may not have actually heard of this before unless, in passing, myself or another pain doc may have mentioned it as an option. But how is it different than the other ones that have been around since 1970? It's that frequency that it's offering, right? So it's a higher frequency. And what the older versions used to do is it would actually override, instead of feeling a pain signal, what you would do is you would replace that pain signal with a tingling sensation, kind of like white noise. Like back in the day, if you had the TV on, but the cable was off, and you just had that white hissing sound, that's what it would feel like in your leg instead of a sharp pain. Not a lot of people like that feeling though. A few small subset of people actually did until they realized there was another option. We didn't have to feel that, and you could just turn down that pain signal. So when we say the term paresthesia free, that's without feeling that tingling sensation instead of the pain. It just turns down the pain. So that's where this differs from what else is on the market. And since this went live and got patented, all of the other devices that you may have heard about out there, so there's other brands, right? So, Nevro, people close their ears, right? So there's Medtronic and Abbott and Boston Scientific. There was one that was removed from the market, which is Nuvectra. There's other devices out there. However, they've all been chasing their tails, trying to show that they're almost equivalent to this, because this is now driving the market and showing that they can get the most relief. So not just 50%, but more than that, 80% relief of this pain without causing tingling instead for a long period of time, right? So there's studies that are going years now with maintaining this relief. So moving down the slide here. So again, that term paresthesia free, we're not replacing that pain with a tingling sensation instead. And this is actually the only device that is FDA approved that you can still have on and working while you're sleeping and while you're driving or operating heavy machinery. So for people out there who are in the service, if you have any of those, the other devices technically are not allowed to be used if you're driving a tank, driving a car. They technically have to be turned off. And why is that? Because if you move the wrong way, if you cough or sneeze, you may get shocked, right? It may cause what we call supratherapeutic stimulation, more than you want stimulation, which can cause a pretty uncomfortable feeling. And if you're operating a heavy machine, you might crash, right? So that's why this is my top recommendation, because you're not limited in how you can use it. So let's move on to the next slide here. Okay, so a few facts about this. How does it work? Where do we start? And what does it look like if I want to try this? So what we do is, the beauty of this is you don't have to, like a pacemaker, just put this in and see if it flies, right? You take it home as a test drive. Usually we do that for a few days. You come in very similar to what you do for an epidural, usually a little martini through the IV, a little numbing medicine at the skin, put a little needle in there the same way, but instead of just putting medication through the needle, we actually slide a little wire into that space. You put a piece of tape over it, you take it home for a week, and you actually see if it changes your life. And that's the beauty of it, is you get to make that decision. If it doesn't work, just like a woman in labor who has an epidural catheter, at the end, you take it out, you put a Band-Aid over it, and then you make that decision. So that's the beauty of this in my mind, is it's not a permanent, choice that you have to make right away. Well, I don't know if I want this in me forever, right? So the next question is, okay, is this safe? I don't know about this. You're talking about putting a wire in my back here. Well, what's the risk of that versus what we do with epidural steroid injections? The risk is actually about the same, right? It's just a matter of, instead of just putting medication in there and taking the needle out, there's a wire that stays, right? Pretty rare. Is this FDA approved? The answer is yes. What are you going to feel while that wire is there? Well, after any procedure, anytime you put a needle there, it can be a little sore for a couple of days. So typically this therapy takes about 48 hours to start ramping up and improving things. And after we achieve that relief, so usually it's 5 to 7 days, sometimes we extend a little further, because there's different areas to program. It's not just one spot where we're creating that electrical activity to override the pain signal. You can actually adjust and adapt this depending on what's going on, right? So we kind of work with our kind representatives from Nevro to identify what's optimal for you. And we kind of take it from where, and we actually record that so we know exactly where if we decide to move forward with an implant, I'll tell you more about that, where we're going to program. So the other questions I often get, just to kind of preempt these, and we're going to have questions later, so feel free to hold those, write them down if you think you're going to forget until the end. Can you turn the device off? Yes, there's a remote that comes with this, kind of like a TV remote. Most people leave it on because you don't have to turn it off to go to sleep. You don't have to turn it off to drive. Most people forget that they even have a remote, and we'll show a slide later of the patients who we have implanted, how often they're using their remote, which is pretty infrequently. But yes, you can turn it off. Can you still go through an airport? The answer is yes, just like a pacemaker. They use a little wand. You tell them you have a medical device, you have a little card, and they go, okay, there you go. Can you still have an MRI? The answer is yes, but conditional, right? So there's certain conditions where you can and certain if you can't. The honest answer of that is, if you have a history of cancer and you need to get an MRI of the trunk, so the chest, abdomen, pelvis, on a regular basis, this may not be the perfect fit for you. So just something to keep in mind for those of you out there. Other interesting question we don't have on here, if you have a pacemaker, can I still have this device? Are they going to interfere? And the answer is no. So I've had plenty of patients who have pacemakers who can still have this. So just kind of preempting that one in case that one's floating around out there. So what kind of hardware are we looking at here? So this is kind of the typical setup now. You've got the remote on that left side. Again, most people, it's turned on. They forget they even have it. we usually have you bring it with you if you can find it, for your visits, but even if you did lose it or forget it, that's okay. The other side of this is, if you get great relief from the trial, you decide, hey, I want that in me permanently. We actually put that little battery that you see there on the bottom right of your screen that says Omnia on it. That actually slides under the skin into a little pocket under the skin like a pacemaker. That you actually recharge typically on a daily basis. So that charger gets plugged into the wall. That little flat blue part you see there that's kind of laying flat, that's what you kind of place right over that. And usually it's about 45 minutes while you're watching TV, and that thing stays charged. So that's kind of how that works. That's the hardware that kind of comes with this device. So kind of moving on here, we kind of talked about, hey, you can use it while you're driving, you can use it while you're sleeping. You don't have to use your remote every day. We talk about the charging is fairly convenient. So that's something that comes, is that a downside? There are devices out there that you don't have to recharge, but they produce a lot less energy, and the relief tends to be not as complete as with this one. So are there other options out there if that's a problem? There are potentially. Again, paresthesia free, we're not removing that pain signal and replacing it with a tingly, buzzing feeling, just that pain kind of subsides. And you're not at risk for getting that super therapeutic stimulation of moving the wrong way and getting shocked, which is nice. So for those of you who are into data, all right, well, show me the data. So this is actually 24-month data, so that, if you're into X and Y graphs, that X-axis is in months, so duration of relief. That Y-axis going up and down from 0 to 10 is called a visual analog scale. So that's a pain scale. The max pain, because I'm sure if anyone's asked you about your pain before, the max on a 10 out of 10 scale is a 10, and the least is a 0. So the key here, what you're seeing on these graphs, is on the leftmost side of that graph at 0 months, that's a starting point. The blue line is going to be our Nevro HF10 therapy, and the gray line is comparing that to our traditional spinal cord stimulation, so those other devices that were out there. And you can see the difference in the average relief across all 24 months, that you've got an average pain score of about 2.4 compared to a 4.5 with the other device, right? So that's why, I personally prefer this device for my patients, and why I feel so strongly that when you're starting at an 8 out of 10 and this has been affecting your life, that this may be a great option for patients who've tried other things and have failed, right? So that's pretty profound data, and it can really change your life going from a constant 8 or even just an intermittent 8 that's really affecting your function to being at a 2.4, right? So what's our experience with this? So we've got a number of patients here in our personal practice who've had this device, who've had the trials, who've had this implanted, who are still doing really well about 2 years out. The question is this for everyone? Again, not necessarily, but it's definitely something to consider. Can this reduce the burden and need for opioids? We've shown that it can in our personal patients, as well as the larger national studies and international studies. How many of our patients are reporting an improvement from where they were before? Quite a number of them, so about 80%. So we've got pretty good data here at SpineOne that matches that national data that I just showed you on that previous slide, going out 24 months from previously. So showing you some data in different forms here. So you got a nice pie chart. So how many patients tend to respond to this therapy during the trial, right? What are the odds that if you decide to do a trial, if we discuss it and decide that you're a good candidate for it? So it's about 80%, and it kind of fits that national responder rate, which is typically what we see. But that also does leave about 21% of patients that aren't necessarily fit for this device. And unfortunately, that is the reality nationally, that just doesn't fit everyone, which is a shame. But a vast majority of people do respond to it. So a little data there for you. So how are we individualizing this therapy? There's a number of ways. So if charging is an issue, like, hey, I really don't like having to charge this every day, you can actually reduce the amount of energy you're using. Instead of having a constant signal that's being sent, we try to reduce that. And instead of constant, we kind of turn off and on. Not that you know it's happening, but it reduces the amount of energy being used on a daily basis, so you don't have to charge every day. Where we're programming, so we can actually determine along that wire where we're creating that energy. So while doing that, we're actually individualizing this therapy. So even though a number of patients have this device, it may be being used slightly separately and differently. So a little more data just about our personal experience with these patients and with our successes with this treatment with Nevro HF10. So how many patients are responding and feel like they're doing a great deal better? So you can see here, this is quite a number of patients. It's not everyone, of course, but pretty supportive, right? And again, it fits that national average, about 80 to 85%. So we're pretty selective about who we choose for this. But a majority of our patients, it is helping and they overall feel better. So kind of data from our previous patients. Are you sleeping better? Is your function improved compared to prior to this device? Again, the majority of patients that we are selecting for this are having better sleep, are having better function. Unfortunately, it is not everyone, as much as we would like, but, very supportive that most of our patients are doing really well with this. Kind of feedback, would you do this all again? Would you recommend it to a friend? If you could turn back time, would you do it again? Again, most of our patients, again, are saying yes. So again, very supportive that people are doing really well with this. Obviously, this is very subjective information, but I like to think that this is very supportive. The charging, so in my mind, when I think of the device, if I was going to have it for myself, for my own back, or for my own pain problem, the idea of charging something, it's like, well, I charge my phone every night. Would that stop me from getting this? In my mind, no. Is it inconvenient? Well, I suppose having to plug your phone in every night isn't the most convenient thing because we're in a more wireless age these days, but all things considered, less than an hour a night is not affecting the satisfaction, which we like to see. So we're seeing that 80% of patients don't mind they have to charge this. And no one's dissatisfied or very dissatisfied with that, which is nice to hear. Again, we talked about how often are you actually using this remote control? And what we're finding is once or less per week. And some patients are actually never. So almost 30% of people never use their remote, which is why I joke about they actually don't know where it is, which is nice because, hey, it stays on. They're doing great. They don't have to mess with it. Unlike those other devices out there where you have to turn it on in the morning, turn it off before you go to bed, turn it off before you get in the car, turn it on after you get out of the car. So we're seeing a lot more remote use with those other devices that are on the market. Again, are patients actually still using this while they're driving and sleeping? And 100% are yes. I guess we can actually, yeah. This is actually on the Nevro website. If you guys kind of wanted to get a feel for, Rod's experience with this, give him his life back. I've actually already watched this video, but it is available on the Nevro website if you do want to check that out as far as that testimonial. But just to summarize, great therapy option out there. Again, it's not the first thing I would try as far as pain. If you do have questions about this, or you think this is something you might be interested in, feel free to contact us. Our information, our phone number is right there at the bottom of the page there, 303-367-2225. Happy to discuss this more with you. Happy to put the device in your hand so you can see what we're talking about as far as like, hey, is there gonna be a battery inside me? If I'm thinking about that, I wanna see what we're talking about. And we can certainly talk further about those options and give you a little more information beyond what we just did here today. So hopefully that answers some of your questions and gives you a little more information about this exciting treatment that we're happy to offer. Keep in mind, you don't have to make a permanent decision. You can take it for a test ride, take a trial, okay? Hope you guys have a great night. Hope it's restful. Stay safe and stay healthy out there, okay?